Let's talk about the state of affairs, because I'm a critic of the Liberal government and I don't want my partisan bias to color my observations on the veterans file. If there's something they are doing right, I'd like to acknowledge it. In fact, it's important that I do, because I don't think veterans issues should be a conservative versus liberal issue. I think every party should be wanting to outdo each other. It should be unanimity. Sometimes I talk about seeing eye dogs. Who could be against that? Widows and orphans. I think veterans should be in that same category, that there's no daylight between there should be no daylight between any of the parties on how we treat veterans. Is there anything I can point to and give the Liberals credit for?
It's a tough one. I agree. It should become, and I hope it does at some point, become a nonpartisan issue, because there are good people on both sides of the aisle, on every side of the aisle, that do want to support veterans. The problem that we seem to run into is, regardless of the party in power, the bureaucracy within Veterans Affairs, the mentality within Veterans Affairs that puts an incredible onus on paperwork and red tape and pushes veterans to the brink of giving up, just never seems to end. So I'll certainly give the Prime Minister credit for saying the right things recently. He clearly had his misstep when he said veterans were asking for more than they could afford, but he has put forward the right policy platform to support veterans in many cases. It's not been enacted the way we would like to see it enacted, certainly not with the speed that we'd like to see. We haven't seen consistency at the ministerial level. We've gone through 5 ministers, and if rumors are correct, we'll have a 6th minister in a couple of weeks. So he's saying the right things as the Conservatives did as well, but we're not seeing the follow through that we'd like to see.
This isn't just a problem for Liberal parties. I sometimes spend some time over in the United Kingdom, and I see how they treat their vets too. And they've had a Conservative government in name, at least, for some years. And over there, and I'm sort of embarrassed actually that I know some British stats more than our own Conservative stats, but my buddy Tommy Robinson out there brought to my attention there was a hospital for vets specializing in PTSD. And I didn't know just how widespread that was. I mean, I suppose in World War I it was called shell shock. They didn't have the word PTSD, but I didn't realize how widespread it was. And even in the UK, under a Conservative government, they were shutting down the medical support for vets. How is it on the medical side? It's one thing to show moral support and have financial support, but PTSD or shell shock and the psychological trauma of these awful wars, the terrorist wars where children themselves are often the human, bulletproof vest, like human shields. Are we properly addressing the psychological damage done to our vets in Canada?
A mixed result, I'd say. So, more than a decade ago, the Conservatives opened the occupational stress injury clinics across Canada. The Liberals put more money into it and offered up a couple of more clinics to expand the service capacity. The challenge there is that it still isn't enough. The wait times are still too long. We had another suicide just last week from somebody suffering that wasn't getting help in a timely way. We've seen the government drag their feet on recognizing the importance of service dogs and providing those to veterans for those that it helps. We've seen them roll back the cannabis allotment a couple of years ago, saying that the veterans were getting too much cannabis for free for those that it helped. So a mixed bag. Again, on paper, they're opening the right clinics. They're hiring specialists in this category. They're certainly, trying to destigmatize the scourge that is PTSD, but the bureaucracy again gets in the way. And you think about this: you have a veteran, and he phones for help, and he starts getting told about the forms he's going to fill out. Yeah. And that he's got to see a doctor to get another form filled out, and then they're going to process it, and then he's going to get a call from a clinic in a few weeks, hopefully. And the frustration builds. So the person, because they have this mental injury, starts self-medicating while they're waiting for proper treatment. And as they self-medicate, they run into the same problems that other people that become addicted to drugs and alcohol run into. They have fights with their spouses. They have fights with their employer and lose their job. And the spiral begins. And it's like an airplane whose wings have fallen off. It doesn't take long before the spiral ends in a terrible crash. And in many cases, that's a suicide. So the Liberals in their platform, said a very important thing, and I hope they live up to it, which is that they will ensure that a veteran can have up to $3,000 worth of treatment before they're diagnosed. So if a veteran calls the helpline, they can immediately be transferred to a hotline where you have a mental health care professional at the other end that begins speaking to the veteran and helping them before we worry about the paperwork. Mm-hmm. If that occurs, maybe, just maybe, we'll save a few lives here.
That's an excerpt from the Ezra Levant Show, which is a show I do every day. I do a monologue, interview an interesting guest, and then I read my hate mail. But you've got to subscribe to it, which you can do at premium.rebelnews.com.